in a perfect world, everyone is healthy and has access to affordable care that they need. But in reality, that's not the case. There are plenty of people suffering and or dying because they don't have access to the healthcare they vitally need, and that's due to a lack of resources and education. And that's why we're here today, to achieve optimal care for everyone by educating our providers on health disparities throughout our community to reduce the mortality rates in pregnant women and infants throughout the state of New Jersey. So first, we're going to talk a little bit about what health equity is. So everyone has this belief that everyone should have health equality. Now, equality is the belief that people should have access to all of the same resources, whether they suit their needs or not. So I think this diagram really displays as to what equality is versus equity. We have a man that is too big for the bike. We have a child that's too small for it. And the woman on the left isn't even able to ride the bike. So we're striving for health equity, and equity is when people have the fair and just opportunity to attain their full health potential and be as healthy as possible. So we're able to fit the needs of every client individually. We have the man that has a bigger bike, the child has a smaller bike, and the woman on the left has a special bike that was created for her. And that's because equity means that everyone gets exactly what they need to be able to participate. Now, another important factor in health equity is talking about health status and what exactly it means. So here's a picture of an iceberg. What we know about icebergs is that everything that you see, there is so much more living beneath the surface that you don't see. So let's pretend that the iceberg is a pregnant mom. So what we see is the woman's health status, and that's whether she is sick or whether she is well. And what's right at the surface of the picture is health services and her access to healthcare. Many people think that as long as you have equal access to care, all of these challenges people face with their health will be solved. But in reality, what makes up a person's health is not what happens at the surface. What makes up a person's health is everything that lies underneath the surface. We see that there is so much more. There's income and social status, there's physical environment, social environment, a bunch of different factors that impact a person's health. And we see that under the surface, there are both personal and group assumptions, beliefs, and values, which also play a role in a person's health. Now, one of the important factors that we are going to talk about today is infant and maternal mortality rates. So I just want to give a couple quick definitions and what those statistics are going to look like. So infant mortality rate is the death of an infant before his or her first birthday. And that rate is based on the number of deaths for every 1,000th live birth. Now, maternal mortality is the death of a woman during pregnancy, at delivery, or even up to a year after the end of the pregnancy for whatever reason. Now, pregnancy-related mortality ratio or maternal mortality ratio is the estimated number of maternal deaths for every 100,000th live birth. Now, once we look at infant mortality rate, you can see that all of these numbers are based on all of the races. The race is not into account in this. So for the United States, it's 5.8 for every 1,000th live birth. And in New Jersey, it's 4.4 deaths for every 1,000th birth. Now, we are ranked 6th throughout the entire country, tied with 2 other states, and that is pretty well. Even though in 2017, 22,000 infants died. And the main reasons cited for these deaths were birth defects, low birth weight, preterm birth, maternal pregnancy complications, sudden infant death syndrome, and injuries. So once we look at maternal mortality ratio and what that means, according to the United Health Foundation, the overall maternal rate in the United States and in New Jersey, respectively, was 29.6 and 46.4. Now, these statistics, along with the infant mortality statistics, were not accounted for race. And we can see that our statistic for New Jersey is a lot higher compared to the entire country. And that's why we're ranked 4th highest throughout the entire country, which means we do have some work to do. But what happens when we break it down based on race? So looking at Black infant mortality rate, we just learned that the overall infant mortality rate in the United States last year was 5.8. But look what happens when we account for race. We see that Black babies are dying at a rate a little more than 2 times higher than white babies throughout our entire country. And we also learned that in New Jersey, the infant mortality ratio last year was 4.4. But when we account race and take a deeper look into the data, we see that Black babies are dying at a rate 3 times higher than white babies here in our state. And we had learned that our infant mortality ratio was pretty well compared to other states throughout our country. And we also remember that the maternal mortality ratio was not so great. So what happens when we put race into our maternal mortality rate? We learned that the overall maternal ratio in the United States last year was 29.6. But when we account for race, we see that Black women are dying at a rate nearly 3 times higher than their white counterparts. And for New Jersey is the scary part. We learned that our Black maternal mortality rate here in our state is 131.8, when the white women are 34.7. And this means that in 2019, Black women living in New Jersey were 4 times more likely to die than a white mom. You would think that with all of the resources and technology that has progressed since 2019, our statistics would be better this year. But sadly, we're mistaken. First Lady Tammy Murphy did release a statement that in 2021, Black moms living in New Jersey are now 7 times more likely to die than white moms. And that's why we're here today. We're here to look at the different factors into why our statistics are so terrible. So we know that race matters. Now let's take a look from a different angle. Let's look at infant mortality in context of place. Where are all these babies dying? So let's compare Morris County, which is blue, therefore has a low infant mortality ratio of 2.3, compared to Warren County, which is orange, which means that their statistic is about 4.6. And this means that infants have a higher risk of dying in Warren County compared to Morris. Now, why is that? There are major differences in counties in terms of demographics, food access, healthcare access. So not only does race matter, but where a family lives and ultimately what resources are available to that family matters as well. Now we've seen news articles after news articles reporting the grim reality for women and babies in this country and the inequalities that exist for racial and ethnic minorities, leading to poor birth outcomes, especially for Black moms and babies. And what is the reason for this gap? Why are white women able to experience such better birth outcomes than Black moms? Why are white babies reaching their first birthdays and beyond, and Black babies are struggling to survive? Now, Serena Williams has all of the money at her disposal, and yet she still almost died during childbirth. So that lets us know that it's not just because of low socioeconomic status or low educational attainment that Black moms are at a higher risk to lose their life and their babies. It has to be deeper than that. The reason that Serena Williams almost died giving birth to her baby has to reside somewhere in the roots of our healthcare system. Now, one of the factors that was found that is a problem throughout our healthcare system is implicit biases. And those are attitudes or stereotypes that affect our understanding, actions, and decisions in an unconscious manner. Now, these biases are activated involuntarily and without an individual's awareness or intentional control, and not accessible through introspection. So in other words, it's the subconscious things that we think about people, places, or things, thus that we don't even recognize that we have about people. It's our automatic assumptions. Now, one of the ways that we strive to identify our own implicit biases and change it throughout our healthcare system was by creating a free assessment tool. Now, Harvard did create a implicit bias association test, and it's to help individuals identify their own implicit biases. And I highly recommend that everyone participates in this self-evaluation. Now, their website is filled with an abundance of information and statistics on implicit biases throughout the country, and it's broken down by states. Now, after taking a look into implicit biases, let's take a deeper look into those biases throughout our healthcare system, and that's also known as systemic racism. And those are policies and practices that exist throughout a whole society or organization that result in providers providing differential treatment to patients according to the color of their skin. Now, these implicit biases in a clinical setting simply means that providers, and this could mean anyone in the healthcare system from the receptionist to the physician, and much like all of us, have these automatic assumptions or associations that get in the way of providing the best care to their patient. And this can play out in several different ways. So there are 5 main factors that we have identified that are implicit biases throughout the clinical setting. Now, some providers believe that Black women don't feel pain in the same way or the same degree as white women, and therefore are not as quick to prescribe pain relieving medication. Implicit biases can affect both perception and clinical decision making, and studies show that implicit bias is significantly related to patient-provider interactions and treatment decisions. In addition, anxiety about interactions with colored people can result in white providers spending less time with their colored patients. Now, some healthcare providers have implicit bias in terms of positive attitudes toward whites and negative attitudes towards Blacks, and therefore provide better services or treatment to their white patients. Now, after a review of the implicit association test and all of the data, it does suggest that healthcare professionals and surgeons hold implicit and explicit associations with men in careers of surgery compared to women in career of family and child medicine. Now, the last factor is the negative and stigmatizing attitudes towards individuals living with a mental health challenge. And that's because they're held at a subconscious level that are automatically activated during practitioner-client encounters, often leaving the patient with insufficient care. So we've talked about what health equity means, the scary statistics throughout New Jersey, and we've talked about the factors that are a problem and what are we doing about it? What is New Jersey doing to fight these statistics? Now, Nurture New Jersey was created by First Lady Tammy Murphy, and it aims to change the status quo in maternal and infant health in New Jersey, accelerate progress through racial equity, and influence the broader field of maternal and infant health in the United States. It focuses on improving collaboration and programming between departments, agencies, and stakeholders to achieve its goal of making New Jersey the safest place in the country to give birth and raise a baby. And one initiative under Nurture New Jersey is our Healthy Women, Healthy Families program. Now, throughout the entire state, every county has this program to pair a woman of childbearing age with a state-certified community health worker. And for Project Self-Sufficiency, I am very lucky to be that community health worker. I help the client navigate their health needs, teach them how to advocate for themselves, and even provide advocacy when needed for the client. Now, this program is long-term service, and it takes a deeper look into the client's social determinants of health and connects them to services either here at PSS or another community-based agency. And we also conduct periodic assessments on the family every 6 months to address any kind of uprising needs. Now, for clients that are looking for shorter term services or care, we have our Central Intake Help Hotline, and it is now called Next Step. And Next Step provides clients with their next meal, their next ride, their next doctor visit, next safe place to sleep, and more. Now, another opportunity that we do offer our clients is our home visitation program, which is an evidence-based program intended to improve the health outcomes of moms and their babies by getting them connected with a registered nurse. So I know we talked a lot today about health equity, what it means, the statistics throughout New Jersey, what are the root causes of it. And we know that New Jersey is doing something to fight the battle. And that's why we're here today. We're here to give information to our providers to get the word out and try to improve our rates throughout New Jersey and our country.